Joining us now is Director Jim Carroll, and it's always good to have him on. National Drug Control Policy in the Trump administration. Director Carroll, great to have you.
Good morning. It's great to be on the show again, John.
We're all focused right now on the coronavirus, obviously the impact with the economy and everything else. Can you give us an update of where we are on the opioid crisis today, how that kind of fits in with overall policy? And then I'm going to open this up to some phone calls because, Director Carroll, the last time that you were on, I had a plethora of listeners texting me or emailing us. They wanted to be able to ask you questions, so I'm going to do that as well. But give us an update, sir.
John, I was very honored that Congressman Griffith invited me to come down to the Tri-City areas of Virginia. We were in Wise and spent the day there talking to people, talking to community members, talking to treatment providers, and talking to law enforcement about all the efforts down there that they are doing to save more lives, to make sure that more people get treatment. And it was a great day.
So give us an input of some of the people you met with, and what kind of a difference you think you guys are making.
Well, really, I would say it's the people of Virginia. Your listeners are the ones that are making a difference. The community leaders down there. We met with the mayor of Wise. We met with the sheriffs and law enforcement. We met with the head of UVA, the Wise facility down there, talking about student involvement and making sure, that people are getting treatment. It was really a wonderful day. Virginia is slightly above the national average of the number of lives saved because for the first time in almost 30 years, we have a reduction in the number of Americans that are dying. It's 4.1 nationally and about 4.5% reduction in Virginia. And so I wanted to go down there, be with the congressman, and really find out what your listeners are hearing and know every single day. John, thank you for spreading the message about getting help to people.
Well, Director Carroll, look, you guys have done a miraculous job. You look at the opioid crisis and the number of people that died, and now how that's gone down and the pro-action that you've taken all across the United States, certainly Virginia and Southwest Virginia. I mean, the opioid crisis hitting manufacturing sectors the hardest, obviously unemployment, low income, people not having jobs, being stressed over that has really taken a toll. We're going to open this for phone calls, 888-480-JOHN, 888-480-5646. A lot of calls last week after Director Carroll got off about various stories about your own family and some of the experience you've had with the opioid crisis, and you want to tie that in to the coronavirus, that's fine. But if you'd like to ask the director a question, 888-480-5646, 888-480-5646. Carroll will get you right on if you want to weigh in. Going forward, Director Carroll, with all the emphasis right now going on the coronavirus, and right. The president with his press conference yesterday really asking for 15 days of stay home, don't do anything, try to get this under control. How does that affect what you're doing with opioids? How does it affect it, and how does it tie in, sir?
Well, what I'm doing is, first off, is making sure my employees, I have almost 100 employees. We went through telework training last week, and I would say 90 of them are teleworking today, and there's 10 of us in the office spread out to make sure that we're not in close contact with each other. Even though my nearest person is about 10 feet away, I'm calling him instead of walking down to the office or vice versa just to make sure. But what we're doing is, in terms of the coronavirus, is we are making certain that people who need the medication-assisted treatment drugs that are out there, some of them are dispensed on a daily basis. We were working with the DEA and Health and Human Services last night at 9 o'clock p.m. and making sure we can cut through the red tape of making sure those drugs are available to people. We don't want those people, who are using these medications to get off opioids to, cycle back because they can't get these life-saving drugs. And so like I said, we were on the phone last night making sure we're cutting through the red tape. That's a priority for today as well. And we're also looking at it in the broader way of other drugs, even not related to the opioid crisis, about cutting through the red tape to make sure your pharmacies have what they need. And so we're all pitching in and doing what we can. Just like you, John.
Well, thank you. We've all got to make some changes, Director Carroll, in our life during this period. Let's get to just an aside here. You've got 100 employees. These are federal employees of the federal government. What is their attitude?
I think, they all are paying attention. They understand what the president has said. They, are working from home. They're worried. They're worried for, their parents, who are elderly or family members. I have one whose, husband is really battling cancer and 2 employees who are battling cancer. And so, they're worried, and they were the first ones, that we made sure last week, were protected and not exposed to other employees. And, they're making sure that they have enough supplies, for their families. But they feel confident that we're all going to get through this. John, I know you feel that way, and I think we will. We're a strong, tough nation, and, we'll get through to the other side.
Director Carroll, the opioid crisis, when you took it over, deaths are way down, and the addiction is ebbing. You guys have done a phenomenal job at that. I've had so many listeners that their family members got caught up in this. Give us your advice to a family, someone that you think might be maybe a teenager, maybe a young adult, your husband, your wife, somebody that, what are the signs where you think, okay, maybe they're getting from taking opioids the right way to addiction? What are the signs, Director Carroll?
What you're looking for is someone with the craving is so bad. Your body is going through a withdrawal because you've been taking them. And it can happen, the medical professionals say high-dose opioid prescriptions for 5 consistent days has a much greater chance at that point of getting someone physically dependent on the drug. And so if you, are finding yourself in that situation where you're looking for, the relief of taking an opioid, not so much for pain, but for distancing yourself emotionally and mentally, your body as those cravings for it, that's when you realize you need help. And that was one of the things that we realized when, at the end of last year, we launched a new website, findtreatment.gov. We talked about it before, John, when we were on your show. 35,000 state-licensed facilities across the country. Just put in your zip code, and you can find treatment facilities in your area, all sorts of drop-down menus if you have insurance, if you don't have insurance, and, along those lines to make sure that when you need help, you can get help. And if you're at that point, talk to a medical professional, find out what the issue is. And if or if you have a family member that has an addiction, that's one way to go about getting help, findtreatment.gov.
Will you say that website again?
Sure. It is findtreatment.gov.
That's FIND, findtreatment.gov. Just put your zip code in there, and you're
completely anonymous. Yeah,
good to go.
No
right,
names,
it's anonymous. We're with Jim Carroll. He's a director of the Office of National Drug Control Policy. In common terms, we call that Trump's drug czar in the Trump administration. Director, let's go to, do you have any responsibility, any crossover with dealing with this virus now within your office?
Yeah, what we're doing is we're making sure that, across the spectrum, we're used to making sure that people get medication for an opioid addiction or others. And so we've broadened our approach to working with DEA and HHS to make sure that the treatment centers that we're used to connecting people with, that those networks are now being deployed to help, people find health treatment. And we're teaching some of our other government agencies about how communities are coming together to help each other in times of need. And so, flakes like wise when I was there, 10 days ago about how they're coming together and helping each other. So we're talking about, opening up medication to more people, making sure that we're getting examples of communities coming together. And also, Don, I know you know this, but also the power of prayer about how these communities are coming together. Their strong faith is giving them strength. It's giving me strength. It's giving all of us strength. And what communities are doing across the board. And so that this is how we're working on it, making sure that we're getting resources to communities.
Tell us about that when you say the power of prayer in communities. You're a government official, so it's not often we get a government official saying that that's really making a difference. Can you elaborate on that, sir?
Absolutely. I am very proud, to be able to say to anyone and everyone that my faith is the cornerstone of everything that I do. My relationship, with God is strong, and it's certainly, I'm praying every day now for our country for this issue. But what we also know scientifically in the addiction world is that the people who go to a treatment center that has a faith component have better results than the treatment centers that don't have a faith component. I realize that some people don't, and I pray for them too. But if they want to go to a treatment center that doesn't have it, that's great, and there are good success stories. But as I said, the ones that have faith as a central component are having better results. And so you just look at the science and realize that there is a greater power, there is a God that it works in my life, hopefully in yours, John, and I think in so many of your listeners.
Well, certainly in mine, Director Carroll, and I appreciate your saying that. And facts are facts, because basically what you're outlining here is that you've got evidence that in the centers that are treating addiction that are secular, they're not getting a good as a result at the end of the day. And you're looking at results, obviously, because people's lives and well-being are at risk. They're not getting as good as a result as those centers that have faith-based in the center of their operating status. I mean, facts are facts, right?
Yeah, they are, and I realize that maybe some of your listeners might not appreciate that, and that's okay. There's lots of treatment centers that don't have it. They're still getting good results, but facts are facts. You say it every time. When you start your radio show, John, and throughout your show, you talk about reporting the truth, and right. This is the truth. The truth
and the truth.
Yep. And so this is one of those situations.
Well, you know what? It's getting harder and harder to do in today's environment, Director Carroll. I'll tell you that, because people want to hear what they want to hear. There's also sorts of weird stuff happening. All right, we're going to open the phone lines up. 888-480-JOHN, 888-480-JOHN, 888-480-5646. If you have a question or comment for Director Jim Carroll, we'd like to hear it now. Okay, let's get to Rick from Virginia Beach. You're on the line with Director Carroll.
Hey, good morning, John. And Director Carroll, just want to say good morning.
Good morning.
Thank you for all the work that you've been doing. Just wanted to say something really quick about the fact that you just started sharing your faith and talking about addiction and that recovery process. There is absolute fact to how much better people do respond when they do have that faith in a higher power. And it's not just any higher power, but specifically going through a Christ-based recovery program. One of the really good programs that are out there that is not only for those that are addicted, but also for their families to help them out is Celebrate Recovery. And we have an amazing program here in Virginia Beach. The program started out in Southern California through Saddleback Church, but we are seeing amazing results reaching out into the prisons and to some of the other areas that where people do struggle with addiction. And as they transition out, they're able to go to these small groups and really focus on their relationship with Christ, but also focus on themselves and fixing themselves. But at the same time, a lot of these programs are specifically only for the people who are struggling with their addiction. The best part about Celebrate Recovery is that if you have any hurt, habit, or hang-up, the family can come along with you, and they can struggle and work through their recovery of going through with a family member who's struggling with their thing. So, because a lot of times these addictions aren't by themselves. Sometimes it's because of people who enable them, or they have hurt with family members, and they're actually able to work on that and work on their own relationship to help not only support the person that is struggling with that opioid addiction, but also able to work on anything. So, I personally go through there. I first started going for anger issues. Come to find out, that was just a symptom of some of the other underlying things. And as a medical provider, it gives me another opportunity and a different way of just traditional counseling for the family members who are struggling with this to go ahead and give them a support group also. So they're working the 12 steps right along with that person who's working through them also. And all that does come through the faith-based portion of it. So thank you for bringing that up, and I really appreciate that, like going through. But here in Virginia Beach, through Grace Bible Church, we have an amazing program right there. So if anyone's interested, just definitely look up Celebrate Recovery in your area. So
Thanks, Rich. Thank you.
Rick, I love the title. Celebrate Recovery. And I'm not familiar with your organization. I've certainly heard of it. I haven't visited. But the title is just perfect because we need to celebrate those people in recovery and need to make sure that people who have an addiction know that recovery is possible. Mm-hmm. It works. You can get there. You can get in a long-term recovery and, turn your life around. And what we also know is something that you also mentioned when I was in WISE is the commitment to people who are incarcerated. And Rick, you mentioned that. And that is something I saw there. But from a clinical perspective of these sheriffs and jailers down in that area trying to get help to people who are incarcerated because they're going to get out. And when they get out, we want them to be in a place of recovery so they're not going back to, engage in criminal activity again and to, use and perhaps, to the point of overdose and fatality. And so, that's what some of the communities, when I talked about earlier, are really coming together to making sure that these people.
And some of the best parts about this, especially through Celebrate Recovery, because recovery is hard. It is incredibly difficult. And whether it's a substance issue or a chemical addiction or even something as simple as anger or codependency, it is incredibly difficult. And we celebrate that with each other because we're all in it together. And first it's just, getting out of that denial, but especially for these guys that are transitioning out of the system, it gives them a safe place where confidentiality and anonymity are key. And they can continue to recover. They can build their accountability team, and they can reach out and have new sponsors. So that way, while they're struggling through this, they can definitely have those people around them. And at a time right now where we're remaining in place and having to be stuck, idle hands are definitely a hard thing to deal with, because when people get bored or they don't have much to do or ways to take their mind off of what's going on, and they don't have their normal outlets of how they normally deal with their struggles, it's going to be an incredibly challenging time. And it's even more important for them to reach out to their accountability partners and reach out to their sponsors because the need or want to use is going to be really, really big.
Yeah, that's great that, family members need help. They, are sometimes so desperate, that they are at the end of their rope, and there's so many great organizations out there. I'm not supposed to endorse one, but one, that I know well, is drugfree.org, drugfree.org. And they're, looking for, making sure that families get supported through this as well. It's a great organization, that is run by, someone that has become a friend, and Fred Munchin, who's, a doctor up there who, really is doing everything he can to put his arms around the families, which we know are also, really hurting when they have a loved one who is going through this.
All right. I want to thank you for calling in, and I appreciate that. Rick, thank you. I got a final question here, text question for Director Jim Carroll. This is Tim in Virginia. He says, many addicts have destroyed their lives financially. Is there any help to get them back in a car and back working? To me, that would be the best help to end relapses.
Absolutely. And what a great point to make. And what we're doing is I'm working, Jared Kushner is working very closely on criminal justice reform. And Jared and I work hand in hand on this issue as well to make sure that people who are coming out of incarceration are able to get jobs. What I'm doing is working with employers to bring people on who have had an addiction. And again, we talk about truth to power, and the truth, the facts are that from the Department of Labor, U.S. Department of Labor, the people who are in long-term recovery are some of the most productive workers in their fields because they're so appreciative of having their life back. They're throwing it, all of their being, into work. And so, again, let the facts take us where they are. And the facts show, that people who are in recovery are great employees. I'm working with the Department of Transportation, to make sure that, we can get people employed, who are, suffering in that field. I'm working with Department of Labor. And, on commerce, we're working with I met with some great, large-scale construction companies who are, have manual trades. We know those folks get injured, more than other trades. And, they get opioid prescriptions because of their injuries. And, sadly, some of them actually wind up, with a dependence, with an addiction. It's getting them back to work and understanding, the importance of having these skilled craftsmen, back able to find jobs. But employers understanding that, they might need to go to a meeting in the middle of the day. They might need, to lean on them for support. And they're great folks. I have a couple of people in recovery at my office. And so, they are just fantastic workers. And, John, they keep it real. They make sure that we're moving in the right direction.
All right, Director Jim Carroll, we are out of time. I really want to thank you for your time with us today and for your hard work, sir, and the tremendous results that you're getting. I know you're working very hard with Jared Kushner, Kellyanne Conway, and many others, and now you've got resources extended to this virus situation. Jim Carroll, Director of the Office of National Drug Control Policy in the Trump administration. Typically, we call him the drug czar. Director Carroll, thank you for talking to our audience, and thanks for being with us today.
Thank you, John. I'm sure we'll talk soon.
All right. John Fredericks Radio Network.